Welcome to the Recovery Centered Podcast, the space for honest conversation about healing, hope, and the journey through mental health and addiction recovery. Each episode, we sit down with people making a difference, from therapists and researchers to change makers and to survivors. Now to explore what recovery really looks like in the world. This podcast is produced in collaboration with Beachway Therapy Center. Hello, everybody, and welcome to another episode of the Recovery Center Podcast. My name is Tim Roberto, and I am definitely your host. What an honor it is to always be here. I come into the studio once a week, and I have the honor of bringing in like tremendous people. And Dr. Theresa is one of those people that she said yes to coming in because she's got so much worth and value and a phenomenal moral compass, and I can vouch for that because I've known her over 10 years now or so.
Over 10.
About 10 years, and like a lot of people that I've known for a long time, because this is a very different space. It's a difficult space. We hold a lot of space. So for the people I know, 10 years plus, like every one of them has just gone, pew, and Dr. Theresa just made another, in her life. So, hey, welcome to the Recovery Center Podcast.
Hi, thank you so much for having me.
Yeah, it's wonderful. So you just opened up your practice, right?
Yeah.
That's incredible compared to when we first met. You and I were just going at it every day, trying to help all these people that were just so tough, and right?
Yeah, absolutely. Yeah, 10 years is a long time.
It is.
I love seeing both of our growth over the decade. Oh, I almost don't even want to use that word.
Oh my God, another decade. I'm going to be 74. Oh my Lord, 74. Jeez. So, hey, it's just part of the deal,
Yeah.
Or you're doing the creep, I'm doing the creep. You watching or doing the creep too.
Yeah.
So catch everybody up to speed, kind of
Sure.
like.
Absolutely. So in the past 10 years, I became a licensed psychologist. So I got my doctorate in clinical psychology. And I went from working in the treatment industry to offering neuropsychological testing and therapy.
I love that.
I am fascinated by the entire field. And really the dream is to put those two together. So offering testing for substance abuse treatment centers, really figuring out how clients' brains function in order to better support their recovery.
Wow, that's like really deep. Is there, obviously you're passionate because you left out your LMHC, which is a licensed mental health counselor. Like, this is the real deal, my friends. She's definitely made not only a commitment to herself, but for the good of others, because, we're still losing tons of people annually, monthly, daily to addiction, mental health, death by suicide. It's, we have all these new things, but we still, the numbers are still there. So to have somebody like you, I love when you say I'm fascinated by it because, well, you're putting your money where your mouth is, because it's just how much dedication you've given to your education and how much time that's taken, and discipline and sweat and,
absolutely.
And is there like a common thread that you see with an alcoholic or an addict versus a mental health patient that has no substance? Like, is there a character, is there a difference in patterns? And
the main difference, I would say, is executive functioning. So it's the frontal lobe of our brain that's responsible for sound decision making, impulse control. All that sounds very familiar when we're talking about our substance abuse clients. That is probably the biggest deficit when we're talking about addicts and alcoholics. So if we look at a typical client coming into treatment, we're probably looking at someone who has long-standing substance use, started using when they were very, very young, when their brain is still developing. So we know that when you're in your teenage years, your frontal lobe is still developing. It is the last part of your brain to develop. And so when you introduce substances at that age, when your brain is still growing, it's going to have some very, very extreme, severe, detrimental consequences to the way that you think. And so executive functioning is probably the biggest difference between substance use clients and I would say general population, call it that. And we see that in poor decisions,
Yeah.
and inability to assess consequences.
Yeah.
If I were to do this, what could happen in the future?
Yeah.
You know, a lot of it is very short term, impulsive,
Yeah.
immediate gratification decisions that are being made. And so that's part of it, is because their brain has not fully developed in that area yet.
So do you think like even like they're impulsivity driven, right? Impulse driven, even though there's a consequence based on the history, the mind, because of that deficit, like can't overcome it, you mean? Like, you know, certain things you think through, right? Like you burn your hand on the stove, you know, who does that every day?
Right. Absolutely.
You know, that kind of like, does it have an effect on it? Like, does it, you know, like if you're using as your brain as the fully developed yet, and is it kind of like that using's turning certain switches off? Like, am I understanding it right? Or
So one of the great things about recovery and abstinence is that it allows your brain to catch up.
oh wow, I love that.
So the goal, when I mentioned doing testing to better support recovery, that's kind of what I mean, is to see very concrete results of how recovery persons' brains function, intervene very specifically, and then watch their growth throughout their recovery. And so that goes very much into brain health, supporting their better coping mechanisms, better behaviors, better habits.
Yeah.
But a lot of it has to do with better brain health habits. So watching what you eat, exercising, sleeping well, taking care of yourself, all of that helps your brain function, as well as maybe reduce some of the deficits that were experienced because of the substances.
So is this a series of several tests, or can you pretty much pinpoint or have a good idea from the first one, or do you need several
Yeah, so it's generally a comprehensive battery. So that means what we want to do is we want to measure each individual part of your brain as much as we possibly can. And so that way we can say, oh, this section of your brain is room for improvement is the nicest way to put it.
Yeah.
So with those results, we can absolutely target interventions and very specific treatment recommendations that we make. We have general recommendations that I give for general brain health to be supportive, and that's across for everyone, not just for those in recovery. But those in recovery, particular attention should be paid to executive functioning, controlling impulses, making better decisions for themselves, things like that.
So like if I met you 19 years ago and I was still in that dark hole, and and then we were working with each other for the last 19 years, and you did a scan on me in the beginning 19 years ago, and you did a scan on me today, would there be a huge difference?
What we will likely see is more activity in the frontal lobe. And so when I go back to saying that the frontal lobe is likely not fully developed in someone in early recovery, you mentioned the scan. What that usually means is there is minimal activity in the frontal lobe. So it's not just us looking at someone being like, you have poor impulses, you need to do better. It's they are biologically affected by the substances that they have been taking, and literally their brain is underdeveloped. So in that moment, they don't even have the capacity to understand the decisions that they make, the consequences they face, the impulse control that they're lacking. So a scan from when you first start in recovery to now we'll likely see is more activity in your frontal lobe, because now it's working.
I mean, when we talk about it like this, it's not like every day when you wake up, you're like, oh, I'm just going to talk about frontal lobe today, But now that it's going down, like I can see your pull towards it, your interest in it, like your fascination with it. Because I'm just sitting here thinking, like, yo, Timmy, bring it back, buddy. Squirrel. 'Cause I got like 1,000 questions already. Like,
Yeah.
it's just really deep. So I was thinking when you were talking, trying to bring it back in. I was like, I bring up neuro pathways, right?
Yes,
and how we can change those. We can change them.
Absolutely.
You can put it in your language, but like grow, is that the right? Like you can grow new or
absolutely.
create.
Create new pathways. Yeah, absolutely.
But what drives that? Like that's incredible. Like
Yeah. I'm going to use an analogy actually, because analogies are incredibly important when we're trying to convey understanding and educate. I had an old supervisor that described neural pathways as, imagine you're walking in a meadow and they're just surrounded by grass. Your habits, your thoughts, behaviors is you walking through the meadow, and eventually you create a path. You create a consistent divot in the ground. It's super easy to follow, and you're just consistently walking that because that's familiar to us. We know that. That's our habit. So when we're creating new pathways, imagine you're back on the meadow, but now you're surrounded by tall grass, and it's unfamiliar. It's scary. It's you don't know what's in there. There could be snakes. And you just don't want to go in there. So when we're talking about creating new pathways, creating new habits, creating new behaviors, it's about getting uncomfortable, facing that fear, having some courage. But it's not just, even if out in the meadow, we're not diving right into the grass. We're not going to be like, okay, I got this. And then you plunge into the grass completely unarmed. No, you have resources with you. You prepare yourself. You get support. You get feedback, trial and error. And so it's...
I like that.
And then so you arm yourself with machetes and weed cutters and stuff like that. And you pave a new way in the grass.
Wow.
And then that becomes your new in-ground habit. But that initial steps and those first that first creating a new pathway is very difficult because it's so uncomfortable and it's so scary.
Yeah, God, I find myself over and over all week, every week for the last 19 years, saying to people, look, man, I don't know what to tell you. You got to start doing what you don't want to do. So you made me think of that by saying that, like.
Absolutely.
It's but it's so based on that alone, that analogy, that explanation, do you feel that's why addiction, maybe not mental health, because what the heck's 100%, what's normal? You know what I mean? Like,
right, absolutely.
What's normal to the spider's chaos for the fly, like, no, I just want to be normal. But for an addict or alcoholism or like those addictive behaviors, I think it's 100% treatable. I just do, because we have the ability to change our thinking, because it's our thinking that keeps putting it in.
Absolutely.
You think that's kind of like in line with what you were talking about? These new neuro allow me the opportunity to heal, to recover, to think differently, change my direction.
Absolutely. Absolutely. And that goes along with what I was saying before about the brain will recover. Amazing. To a certain extent. Obviously there are exceptions and there's other things that we need to take into consideration. But for the most part, the brain can recover. But it's about providing it with the right resources to recover.
So being lost and uncomfortable already at 11, starting to smoke a little weed, do you think my mind, if I never did any of that and just, was directed in another direction, I know, playing drums, sports, after school activities, blah, 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 never drank, never did anything, do you think I would have different cognitive functioning today?
Maybe, yeah. The running joke in healthcare is that the answer is always, it depends. So you're never gonna get a 100% guaranteed answer.
But now that you put it like that, even though it's kind of like a joke, like the inside,
Yeah.
you know, it does make sense though. Like, how do you really know? Like,
Yeah. There are just so many different factors, and substances is just one of them.
yeah,
I mean, we're talking genetics, environmental influences, early interventions, undiagnosed mental health, undiagnosed medical conditions, medications. Like there are just so many
unfortunate
factors.
situations, right?
Exactly,
It can
exactly.
change people's everything.
Absolutely,
Right.
absolutely. You mentioned mental health. Mental health is a huge influence on brain development as well. So if we have undiagnosed anything, any undiagnosed mental health illness, if it's not treated, it will have an effect on your brain. And
And that just kind of like oozes through, doesn't it? Like even the body gets sick too, right? If the brain's not.
absolutely. And that's part of the reason what fascinates me about the brain is everything is connected to your brain. Everything goes through your brain. Your brain is in charge of anything and everything that you do. Yeah, exactly.
Incredible.
Exactly. So it's incredibly important to support brain health. So luckily, there are a lot of there are modifiable lifestyle factors that can improve brain health, both in recovery and in general. I talk about reducing the risk of dementia in the future when I do testing, because I don't just test substance abuse patients. I also test older adults who may be coming in for memory concerns, family history of Alzheimer's, and the family is starting to notice some changes. So I have a lot of conversations with patients about reducing dementia risk in the future. And luckily, there is a lot that we can control that will reduce our risk in the future.
Wow.
Now we can't control family history, we can't control genetics, things like that. But there are a lot of interventions that we can do now that would help prevent or reduce cognitive decline in the future. So I mentioned diet and exercise earlier. Diet and exercise has
Huge,
a
right?
big impact on
Yeah.
brain health. So eating a nutritious, well-balanced diet, having regular exercise, all of that is very supportive of brain health.
Amazing, right?
Yeah.
How complex the body is, and something, if you really think about it, so simple. Exercise, a quick walk.
Yeah.
You know, sometimes the powers in the simplicity for such a complex, like it's already got the complex down, man. It needs that. It doesn't need me sitting on the couch another night. It just wants me to get up and move, you know, right? Go for a nice walk or a run or so for all the people that may have got this might have caught their interest going, it made me do the same thing. So I'm with you. So I'm going to ask the doc, is there any precursors to dementia?
Family history is a big one.
Family
History.
Okay.
Yeah. So family history of Alzheimer's is a big one. And unfortunately, Alzheimer's cannot be diagnosed until after death. That's when it can be confirmed. We certainly can do testing, a lot of scans, and we can make the diagnosis, but it's not 100% confirmed until like an autopsy is performed, unfortunately, which makes it so difficult to diagnose ahead of time. So there's a lot of research right now on how to find those early signs of Alzheimer's, and there's a lot of really good evidence on the early signs. So the plaques in your brain, family history, of course, and with that, luckily, there's treatment that's also coming around to intervene. So there's a lot of medications coming out actually
Amazing.
that if taken early enough has shown evidence to reduce the cognitive decline, to reduce the risk of Alzheimer's. The studies are very, very strong. The findings are very, very strong. But there's still a lot more research to be done. There's just so much research.
Is it common though? Like say for I'm just using me, so you can thank me, everybody. I'm just using me. I know I'm not the only one. Like sometimes you just can't get that memory. Like you're like, wow, man, what was that? Like it's right here, but it just doesn't come. Is that, with age kind of thing? That's not a precursor kind of thing? It's just kind of like an age thing. Like, gosh, what the heck was that? And you got to sit there and think maybe 2 or 3 minutes, and finally you get it. You're like,
absolutely.
Very elusive.
And that's a very good question, because what we see also is age-related memory concerns. So as with anything in our brain and our body, as we get older, things are going to start to decline just naturally. That's
part of the deal.
That's part of the. I know. I know. The privileges of growing older, so we get to deal with this stuff.
Yeah.
Yes, to a certain extent, we at age 80. We know that you are expected to show XYZ declines, generally memory, not being able to remember kind of what you're saying, the right words, or, there's something that happened, it's on the tip of my tongue. That happens a lot. What we look for, though, is any changes in your history. So a lot of patients will come in and be like, I've always had this problem. I've always had difficulty remembering names of people. So then it's like, okay, well, if it's always been a concern and it's happening now, that's not necessarily a sign of dementia. But if you're telling me that you used to be able to, name off a whole bunch of things and remember all of these things, and then now you're barely remembering anything, then it's like, okay, well, let's talk about what that could be. A lot of it has to do with going over medical history, going over any sort of influence to brain health. So medical conditions, medications. Medications is a big one that a lot of people forget about. And I usually like to emphasize that with all of my patients, because as we get older,
I take that? Didn't I take that?
Yep, exactly. Got to take this for this, that for that, and then this to take care of the side effects, and then it's all a nice little cocktail of medications that we have to take when we get older. But those medications can interact with each other. And so what people don't think about is let's take a good look at your medications and what you're taking and see if they're interacting with each other, because some interactions, some of the side effects could mimic cognitive decline. And so there's a lot of, but that's kind of what I'm talking about. There's a lot of factors that go into.
Do you think we're all born with our deck of cards and it just takes time to play it out, play the hand out?
You're talking specifically about the capacity of your brain, or?
I think just in general, maybe just not to pinpoint it and make it difficult. Just like, am I born, or are we born with a certain deck? And then it just takes the time or the span of our life to unfold, to play the hand. Like, so when I was born, I would be on say I'm getting my thing there, my cholesterol medication, right? My statin. Was that already in my deck? It just took me till I was 60. Like, do you think we all have an assigned deck, and it just needs, like I said, it just needs time to unfold?
Yeah.
And like, it's already there. It's just not there at 1 or 2. It's there at 60, 70, 80.
Sure.
Kind of thing. Like, I don't know.
It depends.
Touche. Was that a touche or just nice move, Doc?
So, because now we're getting into the conversation about nature versus nurture. Okay. So it's all about, the deck of cards, in my mind, I interpreted that as nature. So what you were born with, your genetics, your family history, things that you can't control, versus nurture. So the environmental factors, the interventions that were given to you, the opportunities, all of that good stuff. So, I mean, cholesterol, if you wanted to talk about cholesterol specifically, some of that has to do with family history. And then some of that has to do with diet and exercise. And then, as you mentioned, with age, that absolutely is something that you can diet and exercise all day long. But if you have that card in your family history, then yeah, it will likely appear as you get older.
Yeah, well put.
Yeah. But you mentioned it coming up when you're in your 60s, 70s, and that's kind of in line with what we're talking about. There's a lot of preventative interventions or behaviors that we can do now to maybe push that back a little.
Yeah.
So that it doesn't appear when we're 40.
Yeah.
Now it's going to appear when we're 60 or 70.
So let's just back it up, because I think we kind of took off quick out of the gate after the introduction. We were talking about the bio. Tell us like about your bio, because I don't think we ever really did that. You know,
Sure.
Like I said, we took off a bit, and I just wanted to come back there.
Sure.
And
yeah, I got really excited about talking about brain health. We just
we took off quick.
We skipped over my credentials. So I got my first master's actually about 15 years ago. That was when I was in the master's program, but I got my first master's about 10 years ago. That's when I got my LMHC. I worked in substance abuse treatment center as a primary therapist, and I did that for about 6 years before I was a clinical director of at the time they were an intensive outpatient treatment center. I worked with them for about 3 years before I went back to school to get my doctorate. And while I was getting my doctorate, that's when I got introduced to neuropsychological and psychological testing. And I immediately fell in love with it. I was completely fascinated at the amount of research that goes behind these testing, how accurate they are, how helpful they are. And
Amazing.
yeah, and I decided that I would make a shift from substance use to neuropsychological
So you were going to get a PsyD? You got your PsyD,
PsyD,
right?
yep, exactly.
But if you were going to stay in substance, you could have got your PsyD too, right? Don't they kind of interchange?
Yes, yeah.
Like,
I could have absolutely stayed in the treatment
with a
industry.
PsyD.
With the PsyD, exactly.
But is that what you initially went into the PhD program thinking you were just going to continue in sub?
Mm-hmm.
Okay,
Yeah,
okay, gotcha.
absolutely.
And then what you're doing now, how did that get introduced? Like,
So as a part of our doctorate program, the very first semester, we're required to take
right out of the gate.
what is called an intelligence assessment course. And it introduces you to IQ testing. It introduces you to some very general assessments. And immediately I was like, this is fascinating. I am hooked by the testing.
You found your lane.
Absolutely. Right. And then there's other courses to take. Courses on objective personality tests, on projective assessments, and then as a part of the program, you have to do clinical rotations, and that's to introduce you to clients and allows students to practice with real world clients. And one of my clinical rotations was at a testing center.
Center?
Yeah. And so the training was neuropsychological and psychological testing, and they were a primary dental, podiatry, and behavioral health facility. So they had they considered themselves like a one-stop shop. And one of the things they offered was the neuropsychological testing. And so I got trained very, very well with them. I did my internship with them, and then I also did my postdoc with them. So
nice.
I have a few years of training of neuropsychological testing.
So the psychological testing, does that does that cover a variety of situations, or is it geared for just one thing? Is it for SUD, mental health, depression, anxiety, eating disorder?
It's all of the above.
Yes.
Right?
Wow.
And that's what's so good. So there is neuropsychological testing, which is about how your brain functions. So those are the cognitive abilities that we're talking about. It's the frontal lobe, executive functioning, all of that good stuff. The psychological portion is we're looking at objective personality assessments, and that's a lot of the mental health diagnoses. Those are the anxiety, depression, PTSD. It measures personality disorders. That one runs the DSM. So it's a combination of the two.
God, amazing where you're at. So, so is there any specific reason why you got like into this? I mean, yes, you're going for your your doctorates, your PhD. What about like backing up prior? Is there anything that pushed you into this space? Did you have mental health in the family? Did you have, I don't know. Is there anything that pulled you into when you were doing your master's, or it was just kind of like something that this is what I just want to do? Like,
yeah, no, I knew a long time ago that I wanted to be a therapist.
Gotcha.
There was some turmoil in my family growing up, and so it was immediately like, okay, I want to help other people, either in similar situations or otherwise. My original goal was to actually be a marriage and family therapist, because my intention was, if other people are likely experiencing this, I can't possibly be alone in family turmoil and family history kind of things. So that was my original route. So, and in order to be a marriage and family therapist, you had to get a master's degree. So that was always on the horizon.
Yeah. Were you always a good studier?
Yeah, I was, but that's a cultural thing. That is very much, education is very important in Chinese culture. And so education and subsequently working in employment is always a big part of my identity. So yeah, I would say I was a very good student. But so I originally wanted to be a marriage and family therapist, went to my master's program. And while I was there, one of my classmates actually worked at a treatment center, and she had mentioned that they were looking for an office. Yeah.
How it all connects.
They were looking for an office manager. And I was like, sure, I'll work here while I'm going through my master's. Office manager,
licensed manager.
Exactly. And I worked in the field, and it was immediately, I was hooked.
Yeah.
And I find that does happen to me a lot, where I'll have a certain path, I'll have certain goals.
Yeah.
I'll try something new, and immediately it introduces me to a world that I didn't know about that fascinates me, and I shift gears.
But I think you're wired like that. Your mind needs a lot of information because you're very clever. You're smart. You're balanced. You're grounded.
Thank you.
You're welcome. But it's just the truth, and it's like I think those minds that, some people got it, man. Like, I mean, we're all different. We all have our strengths and weaknesses. But I find through my own experience, I'm not that person, but all the people that I do know that I'm honored to know, because in this field there's a wide range of people that have multiple talents, in the mental health space, the addiction space, you're the neuro space. There's just there's a lot of fascinating people in it, and a lot of the people in it have that mind that just I don't know. I'm not a big OCD. I don't know. Just needs information, needs activity, needs stimulation, and you got that. It's like, and you take when something tweaks that, gives the mind, your mind, that little nibble, you're like, the mind's like, you know what I mean? It's like, you go,
I'm gonna go this way.
Yeah. But
Absolutely.
You take it on, man. You do really well in it.
Thank you. I appreciate that.
So are you going to stick for now, like, in just the testing, or would you take an individual on?
So you mean for therapy?
Yeah. Oh, good.
Absolutely. Yeah. So my primary service is neuropsychological and psychological testing, but I do maintain a small caseload.
Yeah, I think you're great. I think you.
Thanks. But deep down in my heart, I'm a therapist, so I can't possibly let that go.
Yeah, but you're, like I said, you're intuitive, and you got a good, like my wife, she's an LCSW, and I tell her she just has a good processor because she's a good listener.
Mm.
She just can listen really well, like,
Yeah.
and then as she, and there's just processes, and like I said, we've known each other, gosh, 10 plus.
Mm-hmm. Yeah.
And I always admired that about you, and I know, because
Thanks.
as my role there, I always got the I always got the scoop,
Yeah.
and they
Yeah.
always admired you, how much you helped them, and
Well, that's nice.
yeah, I
That's
think
very
it's
nice.
wonderful.
Thank you.
Yeah, so you had a grand opening.
Mm-hmm.
Yeah, I had the honor of being invited. It
Oh,
was beautiful. I love the company. You have a partner too, right? Doesn't
thanks.
she?
Yes.
She also offers some other,
Mm-hmm.
right?
Right, absolutely. So I share the office space with a colleague.
Yeah.
She offers accelerated resolution therapy. I'll let her explain what it is,
Yeah.
in a future
Yep.
podcast.
Yep. Yep.
But yeah, one of the great things about us sharing the space is she primarily does therapy. So she does individual, family, couples, groups.
Yeah.
She does all of the interventions. And
Oh, wow.
so when I see patients for testing, I either refer to her
Yep.
or refer to other therapists
Yep.
in the area.
Yeah, I think that's wonderful.
Yeah, we work very well
Yeah,
together.
I liked her. I liked her a lot. She seemed
Yeah.
very determined too. Very
Yeah.
determined, all in. Like,
Mm-hmm.
and I've been around a while, man. Game recognizes game, real
Right.
recognizes real. It's
Yeah.
like
Yeah.
it's really not that hard. And unfortunately, sometimes in this space, it can get a little wonky.
Yeah.
You know,
That's true.
well, you got a lot of people that have struggled for years, and maybe they're not struggling there, but they may have not have done maybe the work they were capable of doing. I'm trying to be polite here, so it kind of morphs out
Mm-hmm.
into other behaviors, and so yeah, I'm very aware of that, very
Mm-hmm.
intuitive with that.
Yeah.
Yeah, because like I've been Beachway Therapy Center. We're a very high end facility.
Mm-hmm.
Everybody wants the Beachway, 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 and you got to filter all through that because we
Yeah.
became that facility after over the last 20 years. Like we've raised that bar, and
Yeah.
but we also treat a lot of people, right? We have our place here, and we have a place in New Jersey. Like we need
Yeah.
good resources, reputable
Right.
resources, top-notch professionals, dedicated people. You just do.
Yeah.
It's
Absolutely.
part of the reputation. It's part of the right thing to do.
Right.
It's part of honoring the moral compass. And
Yeah. Absolutely. Yeah, I think the fact that Beachway has been around for so long, it's in itself a testament to the great things that you guys
yeah,
do. So it's
I get to learn so much too,
yeah,
and I don't have a student loan.
yeah,
You know what I mean?
that's huge.
I'm
That's
around some of the
huge.
best, like the best.
Hmm. Yeah.
Every time we put a post, about one of our therapists,
Hmm.
or it's just like the whole thread, but it's really cool. Like, and
Yeah.
because I've been there I'm in my 8th year, like, I remember that person. I remember that person.
Hmm.
I remember that person.
Yeah.
And just to read all that, it's like,
Hmm.
gosh, and I get to be there, you know what I mean? And I get
Yeah.
paid. Like, it's really cool. That
Living the
yesterday,
dream.
I mean, I'm going off real sideways, right? Somebody likes to confide with me, and they asked me. They were Beachway alumni almost 4 years ago,
Hmm.
and they're killing it. But they wanted
Yeah.
to meet, did a post because everybody knows this person, and
Hmm.
it was just so cool, like to see somebody, and it's a direct result, of
Yeah.
people like you, and who
Yeah.
really care and just been given a gift. And
Yeah.
you're doing just the best you can to help
Yeah.
everybody else kind of move forward, or
Yeah.
anybody. Yeah, because I mean, if you think about it, who the heck knows what to do with a lot of this stuff?
Yeah. Well, yeah, absolutely. That's what you
Parents,
find. Right.
guardians, like what do you
Absolutely.
do? You know what I mean? You got people like you got Marchman at
I was
guard.
gonna
You got
say you find resources, you find good people, you find support.
build that team,
Build absolutely,
build that tribe.
absolutely, absolutely. It takes a
Yeah.
village, and yeah, I'm very, very blessed and fortunate that my brain works the way that it does, and I love being able to give back to anyone and everyone that needs the help.
Yeah.
So it's going back to what I was saying about incorporating the testing with substance abuse
Yeah.
clients, that's really the end goal is
Yeah.
to be able to merge those two together in order to
Yeah,
support
empower
their
people,
recovery.
right?
Exactly.
Especially like me and you and I both know, man, like we said in the beginning of the cast, addiction's 100% treatable.
Yeah.
So to have people like us out there, because I'm always after that one person, and this podcast gives me the opportunity to reach that one person, because there's so many people struggling in silence, that
Absolutely.
might just have heard something that you and I were talking about. And, Theresa can help a lot of people if you're struggling in silence, and asking for help is like one of the boldest things you can do. It's so bold, most of us can't do it. That's how bold it is.
Absolutely. Absolutely.
What about
it's just so daunting. Everyone looks at the first step as it's this mountain that they have to take in one leap, and it's not like that at all. It's that one small step.
It's just gradual. It's like the willingness,
Mm-hmm.
It's a lot of people try to figure their way out of it, and all I can say to that is I became the smartest, dumbest guy I knew.
Yep.
Willpower. I'll never do that again. You don't even have to relate that to mental health or addiction. It's just in anything.
Yeah.
I'll never do that again. The following day, instead of 2 donuts, you're having 3.
Yeah. Yeah.
Well, that was short-lived.
Yep. Exactly.
I just find, for me, I try best I can. It's their due process, not mine, but I just try to get people to maybe entertain willingness. Because I think willingness just trumps willpower and intellect. It just does.
Yeah.
Like, what are you willing to do, Because if you're in the other two, then you're trying to figure it out. Good luck with that. Willpower just doesn't work with this. And a lot of things it does. But with mental health, addiction, the obsession's too great.
Absolutely.
Just trumps on willpower.
Absolutely. I agree.
What do you like in your personal life? Not to get too personal. I meant like, pickleball, tennis. Are you a pool hustler? You go down to like the local.
None of the above.
Run some tables there, Doc.
Can you imagine? I'm here talking about addiction. I'm gambling my weekends with. Please don't use that as a clip. No, I work out.
Nice.
I try to work out consistently. I socialize a lot. And if there's one thing to take away from this podcast, it's to socialize. I always recommend, I tell everyone, you have to surround yourself with good people. You have to interact with people. Just in mental health, brain health, socializing is a great way to keep the brain active and to keep your mental health intact. So, because there is very, very rarely an activity that uses so many components of your brain than socializing. So we're using all parts of our brain right now.
That's crazy.
Just having this conversation.
Tell me about it. I want to go chase the squirrels right now.
Exactly. So your impulse control.
My impulse control.
Exactly. So,
bring it back around, Timmy.
Exactly. So and all you have to do is sit down, have a conversation with someone, hang out with friends, go outside, do all these activities. And so I like spending time with friends and socializing.
So you're practicing what you preach.
Yeah.
Because we have to maintain self-care too.
Oh, absolutely.
It's really important.
Yeah.
How would somebody get in touch with you? Website?
Website, yep. So my company's name is Neurocompass Counseling. And my website is neurocompasscounseling.com. There's all sorts of resources on there. I have articles posted. My bio, an in-depth bio is
Uh,
on there.
uh,
Ways to contact me. I do quick 15-minute phone consultations just to do a quick assessment, because I'd hate for someone to come in, spend all this time, spend all this money with me, and then I can't help them.
Yeah.
So if I collect a little bit of information, why
Yeah.
they're calling is a big one, obviously.
Yeah.
And then if I can help them, great. If not, I have other resources. I have other people that I'd be able to send them to.
Yeah, 100%. I've known you long enough. 100%. I know if you couldn't help him, you wouldn't tell him to come in anyway. No, that's what's so great about you. But that's how people get well,
Absolutely.
Yeah. So say the website one more time.
Sure. neurocompasscounseling.com.
And your email's on there. They can contact you.
Yes.
So if you have any questions or any interest, we just did a very brief overlook, and just had a nice conversation. And but if what the Dr. Theresa explained initially, and then some of the other areas that we went through, if that tweaked your interest, just shoot her, go to the website and shoot her a question or a comment or whatever. And, you can always reach out to me. I'm tim.r@beachway.com. I'm all over social media. Dr. Theresa.
I'm so bad about that. I need to. I am getting on. That is on the list. I'm just on it. In all transparency, I'm just being a brat about it. So I need to.
I get it. It's just, I understand that. I got mine so restricted. I'm just in the business of the message, not the outcome.
Right.
So, to have this platform, and all the people that it reaches just blows me away. And so I think I said it right, tim.r@beachway.com.
Yep.
I'm all over. You can Google. I'm all over. You could probably Google you too, probably, right?
Yes.
Yeah. She'll pop up. Any last minute things you want to say? Yeah, or something that you wanted to say, like, I didn't say that. Maybe that's something that somebody else needed to hear or anything, or
the only thing that pops in my mind is supporting brain health. So I'm very tunnel visioned right now. So but yeah, so take away anything from this podcast. It's good diet, good exercise, good mental health, socializing, and sleep. We forgot to talk about sleep. Yeah.
That's huge, right?
Yeah. It's difficult, but it's extremely important. And that's something that I highly recommend is to get on a good sleep schedule.
Real quick, because I just had a squirrel. If somebody is listening to this and they are struggling with sleeping, is there any simple practices, or it depends?
It depends. No, okay, so quickly, simple. We're talking sleep hygiene then. So then it's about preparing your body and your mind for good sleep. So no screens. Your room has to be pitch black. Taking a hot shower before bed is helpful. No large spicy meals within a couple hours of going to bed. We are training our brain and our body to associate our bed with sleep.
Love that.
So no reading, no work, no screen time in bed, none of the above. The bed is only for sleep.
Love that.
And so following all of these simple tips together consistently, you will eventually train your brain and your body that once you get into bed and get ready for bed, your brain and your body starts to shut down and it begins the process of sleep. So that would probably be the takeaway.
Wow, you can thank me for that one, because that was a lot, but it was really good. Oh my God, that just resonated with me for some reason. It's kind of like a ritual. Mm-hmm. You go to church every Sunday, or you go to the synagogue or whatever. Do that every night, right? Just get into the discipline. It's a discipline.
Absolutely.
Just like making your bed is.
Right. Absolutely.
right?
Absolutely.
Yeah.
And the added benefit is you're training your
Yeah.
brain, you're training that association
Yeah.
so that once you get into bed, your body already knows, oh, this means we're shutting down, we're
Incredible.
going to sleep. Let's prepare our bodies for sleep.
Man, when you listen to it, like the way you put it, it's incredible, man. The level of creative intelligence that the human mind is at. Like, it's just intense. It's so cool,
Yeah.
right? It keeps score of everything.
Yeah.
Hey, I don't speak for anybody, but I will speak for Dr. Theresa in this moment. We're going to wrap this podcast up, and until the next episode, we wish you peace and love. Take care, everybody.